So Perry, if I have severe back pain, what cannabis products should I consider using?
Well, it's interesting. The statistics are 70 to 80% of the U.S. population at one point in time is going to have back pain for whatever reason, whether it's a compression of your disc, nerve roots, bone sticking on there. So there's lots of different ways to approach this. The first one, of course, is topical, because if you want to put something directly on your back, either as an ointment or as a patch to be able to put on there, that's probably the first thing I would try. Of course, you have to remember, with an ointment, it's not going to get absorbed deeply into the tissues to be shown in a urine sample. If you have to test for THC, a patch might be, because it's just none of it gets evaporated. All of it gets absorbed into the system. Again, a combination of a THC, CBD type of ointment or patch on the back is one way to go. Another way to go, quite interestingly, is a product, Rectal Suppository of cannabis by a company, Foria, makes a suppository that really is used primarily for women having pain during their menses. However, it seems to help some people with back pain because it's in, I guess, the general area of the spine, and it has 60 milligrams of THC and 10 milligrams of CBD.
The interesting thing about that product, I've actually taken it for back pain, it actually did help me in my lower back pain, is that you don't experience the psychoactive high, even though it is 60 milligrams.
It's true. Most people seem to get the effect that it doesn't affect them that way. However, that being said, it has been said that it does show up in a tox screen. If someone urinates, THC is going to be shown in there.
Of course, that's a lot of THC. Obviously, the next way you might go is actually vaping or smoking a marijuana strain, correct?
Correct, and that would be another way to help relieve pain in general, whether it's your back or pain in any other part of your body. But back pain's interesting because it'll work to a degree. However, there is some physical problems with your back that no matter the amount of cannabis you take, you actually may need something else done, like surgery at some point in time if you have an actual impingement on your back from a piece of bone sticking on there. So if the pain continues and you start getting terrible numbness, etc., it's probably best at some point in time to get evaluated by a physician about that.
Obviously. And then anecdotally, I find it interesting that we have heard from so many people here at HelloMD who've been in auto accidents where they've had surgeries and they've gone through all of the diagnosis and they still have major back pain or nerve pain. And it seems that a lot of the people have said that smoking marijuana on a daily basis has helped them live a healthier life and get off of opioids.
Well, that's a whole, really, pain, getting off your opioids is a whole other issue having to do with cannabis. And yes, cannabis seems to help people decrease their opioid use if they had been taking opioids and take the place of that and help them with their pain for sure.
Well, that's great. Thank you so much.
You're welcome.